How does a biopsy determine pancreatic cancer (TNM) stage? Imagine trying to solve a puzzle where each piece gives you part of the picture. That's similar to how doctors stage pancreatic cancer. A biopsy is one piece that helps confirm the diagnosis, but it doesn't tell the whole story by itself. Instead, it works together with imaging tests like CT scans or MRI to give a complete picture of the cancer's stage. A biopsy involves taking a small sample of tissue from the pancreas or nearby lymph nodes. This tissue is examined under a microscope to look for cancer cells. It confirms whether the tumor is malignant and provides details about the type of cancer and how aggressive it might be. This is crucial because treatment options depend on knowing exactly what kind of cancer is present. When it comes to staging, the TNM system is used. The T stands for the size and local extent of the tumor. The N indicates whether the cancer has spread to nearby lymph nodes. The M shows if the cancer has spread to distant parts of the body, like the liver or peritoneum. Biopsies are especially helpful for confirming if lymph nodes are involved. Sometimes, doctors perform a biopsy of suspicious lymph nodes using a technique called endoscopic ultrasound-guided fine needle aspiration. If cancer cells are found in these nodes, it supports assigning an N1 or N2 stage, depending on how many nodes are affected. Similarly, if a biopsy of a distant lesion like a liver spot shows cancer cells, it confirms metastasis, which is M1, indicating stage for disease. However, a biopsy doesn't directly measure the size of the tumor or how far it has invaded nearby tissues. Those details come from imaging tests. For example, a CT scan can show if the tumor is small or large and whether it involves nearby blood vessels or organs. The size and local invasion are used to determine the T stage. In practice, doctors combine the biopsy results with imaging findings to assign the full TNM stage. The biopsy confirms the presence of cancer and can identify lymph node or distant metastases, but the actual tumor size and extent of local spread are primarily assessed through imaging. This combined approach helps doctors plan the best treatment, whether that's surgery, chemotherapy, or other options. In summary, a biopsy is a key step in diagnosing pancreatic cancer and can provide important clues about lymph node involvement or metastasis. But it doesn't alone determine the stage. Instead, it works hand in hand with imaging studies to give a complete picture of the disease. This comprehensive assessment is essential for accurate staging, prognosis, and choosing the most appropriate treatment. Always remember to consult healthcare professionals for personalized advice, as each case can vary.